In Pathology Paper 1, out of the 2 essay questions, it is highly likely that one of this question comes from the chapter of hematology. In hematology, we have RBC disorders, we have WBC disorders, and we have platelet disorders. RBC disorders and platelet disorders are kind of straightforward. Students usually answer them well, but students have difficulty in answering the questions about leukemia, such as AML, ALL, CML, and CLL. This scenario becomes even more difficult when they give you a clinical case like this, wherein they give the age of the patient and they also give the symptoms of the patient and ask you to diagnose the case. And they ask you to diagnose the leukemia and ask you what type of leukemia is this, whether it's AML, whether it's ALL, whether it's CML, and whether it's CLL. So the aim of this video is to give you guys a little details, not very detailed, but very less detailed, so that you can answer what type of leukemia is this. So study about this leukemia is later in the textbook, but I think it's a good starting point for you before you start leukemia, whether it's AML, whether it's ALL, whether it's CML, or whether it's CLL. So now leukemia, as you guys know, is blood cancer. Blood cancer means there is more proliferation of blood cells, mostly WBC. That is why it is called as leukemia, because leukocytes are increased. But the idea here is there is more proliferation of blood cells. So more proliferation means there is increased division of these blood cells, and the blood cells are dividing so rapidly that ultimately that will cause something called as leukemia. So where is the fault here? The production is the one which is at fault, whereas the production is more and more. So where does normal production of WBC happen? Where the normal production of blood cells happen? They happen inside the bone marrow. So here is the culprit, that is inside the bone marrow, where you have more and more proliferation of these blood cells. So what is the relationship between bone marrow and blood cells? You guys know that inside the bone marrow, we have a cell which is called as hematopoietic stem cell. So this hematopoietic stem cell is the cell which is the basis for the production of all these cells. That is, whether you have platelets, whether you have your RBC, whether you have WBC, they all come from the hematopoietic stem cell. So now it is very important to know these things. That is, hematopoietic stem cell differentiates itself into two types of cells. So one is the myeloid progenitor cell, one is the lymphoid progenitor cell. So this is the basic idea that you need to know. That is, a hematopoietic stem cell gives rise to a myeloid cell and gives rise to a lymphoid progenitor cell. So if you have some difficulty at the myeloid level, if you have a leukemia in the myeloid level, we call it a myeloid leukemia. Whereas if the leukemia happens at the lymphoid level, we call it a lymphoid leukemia. So based on this, we have myeloid leukemias and lymphoid leukemias. So from the myeloid type, from the myeloid progenitor cell, you have all these cells which come. That is, you have platelets which come from the myeloid cell, you have eosinophils, basophils, and neutrophils which come from the myeloid cells, you have RBC which come from the myeloid cells, and even the monocytes come from the myeloid cells. So all the cells except the lymphocytes, they all come from the myeloid progenitor cell, whereas from the lymphocytes, we get T cells, B cells, and NK cells. So now, very importantly, it just don't happen in this one step, but rather what happens exactly here is a myeloid progenitor cell will give rise to something called as a myeloblast. So we are seeing how a neutrophil is formed. So in neutrophil, initially you have something called as a myeloblast which is being formed. So this myeloblast will then start maturing. It will become promyelocyte, it will become myelocyte, it will become metamyelocyte, it will become band cell, and ultimately it will become something called as a neutrophil. So this process in which a precursor cell will call it a blast. So a myeloid progenitor cell becomes a myeloblast, and this myeloblast will become a promyelocyte, and this promyelocyte will become myelocyte. So this process is called as maturation. So the formation of neutrophil from a myeloblast is called as maturation. So that is one thing. And one more thing is very important to remember is see the size of this segmented neutrophil and see the size of this myeloblast, which is bigger. Obviously the myeloblast is bigger. So always remember one more thing is that a mature cell is smaller than the precursor cell. That is, if you take an RBC for example, RBC will be smaller than an erythroblast. So a myeloid progenitor cell will give rise to an erythroblast, and erythroblast will go through several phases similar to this, and ultimately that will give to an RBC. So the precursor cells are usually bigger than the mature cells. So the blast is bigger than the neutrophil. So one principle here to notice, the mature cells are smaller than the precursor. So the blasts are big cells. So now there are two types of leukemias as we talked about earlier. There are acute leukemias, there are chronic leukemias. In acute leukemias, you have AML and ALL. In chronic leukemias, you have CML and CLL. So now, very, very importantly, this slide is probably the most important slide out of all these slides. But the idea is in acute leukemias, there is proliferation without maturity or with very minimal maturity. So what I mean is the blast cells, they are not maturing. They are not maturing to become mature ultimate final product cells, such as if a myeloblast is not becoming a neutrophil, If there is maturation, the maturation is very, very minimal. It is not much. It doesn't become a mature cell. Whereas in chronic leukemia, there is proliferation with maturation as well. So there is maturity in chronic leukemia, whereas in acute leukemia, there is no maturity. And even if the maturity is there, it is very minimal. If I apply this principle here, that is, when a myeloblast, if it is in a case of acute leukemia and acute myeloblastic leukemia, AML, this myeloblast will not mature, and or if it matures, it maybe goes till promyelocyte, but it will never come to this metamyelocyte, band cell, or segmented neutrophil. It stays in the top portion of it. That is, it just stays as myeloblast, or maybe it becomes promyelocyte, but that's it. It doesn't become a neutrophil. Whereas in chronic myeloid leukemia, it can actually go from myeloblast to the segmented neutrophil as well. So that's why in chronic myeloid leukemia, you'll see promyelocytes, you'll see myelocytes, you'll see metamyelocytes, you'll see band forms, and also segmented neutrophils. So you'll see all these things. But in acute leukemias, you won't see all these things. You'll only see the first few things. That is, you see myeloblast and maybe promyelocytes. So no maturation or very minimal maturation is acute leukemias, whereas maturation, proliferation with maturation is actually chronic leukemias. So now that's why the names itself. So AML stands for acute myeloblastic leukemia. Here we are calling it blast because there is no maturation. So acute myeloblastic leukemia. Whereas in ALL we call it acute lymphoblastic leukemia because lymphoblast and myeloblast, they are not maturing. The precursor cells, we call them blast. So they are called as myeloblastic and lymphoblastic. Whereas CML is called as chronic myelogenous leukemia. Whereas CLL is called as chronic lymphocytic leukemia. So you see the difference here in CLL and ALL. In ALL, we're calling it acute lymphoblastic because the lymphoblasts are not developing into lymphocytes, whereas in CLL, we're calling it lymphocytic, just highlighting the importance that in CLL, it is becoming lymphocyte. It is maturing into a normal lymphocyte. So in acute leukemia, we'll talk about acute leukemias first. We'll talk about what happens in ALL. We'll talk about what happens in AML. So in acute leukemia, as you know earlier, it is proliferation without maturity, or if the maturity happens, it is very minimal maturity. So now, very, very importantly, note that let's talk about AML first. We'll talk about AML first. So what happens in AML? So in AML, what happens is, initially, there is some problem with the myeloid progenitor cell. So myeloid progenitor cell should give rise to normally platelets, some eosinophils, some basophils, erythrocytes, monocytes, and neutrophils. So it is not maturing properly to give rise to all these things. So the patient will have less RBC, less platelets, and less granulocytes, and less monocytes. So all these things will get down. But more importantly, just remember, how is a blast cell? I told you that the size of blast cell is much bigger than the mature cell. So when you have a larger blast cell, so these blast cells are increasing in the bone marrow because they are the ones which are proliferating. So in the bone marrow, what happens is there are complete blasts which are taking over the bone marrow. So when they are taking over the bone marrow, they'll occupy all the space inside the bone marrow. This is even true for ALL. So AML also, you have myeloblasts which are taking over the bone marrow, whereas in ALL, the lymphoblasts are the one which are taking over the bone marrow. So the definition of acute leukemia itself is normal bone marrow, there are normally less than 5% blast, whereas in acute leukemia, there are greater than 20% blasts. So whether it's AML, whether it's ALL, ultimately the blasts are taking over the bone marrow. So there is no space for the other cells to grow. So there are only blasts, there are no other cells. So what happens as a result is there are more. So ultimately what happens is the patient will have decreased amount of other bloodlines. So WBCs have increased, these blast cells are increased. So the patient will have decrease in other things. That is, in acute leukemias, the patient will have very much decreased RBC. So this decreased RBC, what do they lead to? They lead to anemia, they lead to pallor, and they can cause easy fatigability. So easy fatigability because RBC normally carry oxygen. So if you have less RBC, there is less oxygen carrying capacity of blood. So ultimately that person will be very much tired after a simple activity because the person is not getting a lot of oxygen to his tissues. And very, very importantly, even though the WBCs are high, so what type of WBCs are high? The blasts are high. So these blasts are not mature cells. You need mature cells to fight infections. That is the function of WBC, right? Whether it's a neutrophil, whether it's a monocyte, the function of these neutrophil and monocyte is to fight against the bacteria or the other foreign invaders. So here what happens is there are less mature functional WBC. This is very, very important. Even though the total leukocyte count is increased, the mature functional WBC are very much decreased. So when you have decrease in mature functional WBC, what are the symptoms will the patient have? So the patient will have recurrent infections, the patient will have fever. Obviously the person has lost the capability to fight against infections. So the patient will have fever, recurrent respiratory infections. And lastly, the patient will also have less platelets, and especially in acute leukemias, it is very, very important to remember that the platelets will be very much decreased, that is less than 50,000. We call this severe thrombocytopenia, and the patient will have symptoms of severe thrombocytopenia such as bleeding disorders. So there are a lot of bleeding disorders such as petechiae, purpura. Epistaxis is where you bleed from the nose, and then also gum bleeds, which will lead to gum swelling later on. So this is an example of how purpura, ecchymosis, and petechiae look. They are nothing but bleeding into the skin and mucous membranes. Depending on the size, we call them petechiae, ecchymosis, or purpura. But the idea here is spontaneous bleeding has happened for the patient in the skin and in the mucous membranes. So this petechiae purpura formation happens when the blood when the blood platelet count is less than 50,000, which is seen with acute leukemias. It is not seen with chronic, so that is very important that we understand that bleeding disorders are more common with acute leukemias, whether it's AML or whether it's ALL. So now in chronic leukemias, what happens is this myeloid, if it is CML, there's something wrong with the myeloid cell, whether it's if it's CLL, it is something wrong with the lymphoid cell. So we call them myeloproliferative disorders if it is something wrong with the myeloid. If more RBCs are produced, we call it polycythemia vera. If more platelets are produced, we call it essential thrombocythemia. If there are more granulocytes which are getting produced, we call it chronic myeloid leukemia or chronic myelogenous leukemia, which is CML. So depending on that, we call it depending on that, but we'll focus on the CML part. That is, the granulocytes are increased in CML, whether it's neutrophil, whether it's basophil, or whether it's eosinophil. Whereas in CLL, which is chronic lymphoid leukemia, chronic lymphocytic leukemia rather, you have a development of normal mature lymphocytes. So now very, very importantly, this chart is the one which gives you the difference between acute leukemia and chronic leukemia. So in acute leukemia, you see severe anemia. So the anemia is seen in both of these things, usually mild in chronic, whereas in acute you see severe anemia. So severe anemia is the anemia is less than 6, whereas in chronic leukemias it can be usually around 7, 8 depending on the severity of the disease itself. So severe anemia in acute leukemias, whereas moderate and mild to moderate anemia in chronic leukemias. And number 2 is fever and recurrent infections are very common with acute leukemia, because acute leukemia is proliferation without maturation. So ultimately you don't have mature functional WBC. Even though the WBC count is high, you don't have mature WBC, so they are really not ready to fight against infections. Whereas in chronic leukemia, you usually don't have this problem because there is some maturation which has been happening. There is a lot of maturation happens. Ultimately, you'll get neutrophils as well. So they can actually fight off this infection so that you'll not have recurrent infections with chronic leukemias. And now the most important thing, the second most important thing out of this whole chapter is remember bleeding disorders. So I told you in acute leukemias, the platelets are less than 50,000. Whereas in chronic leukemias, they can be normal, sometimes they're increased, sometimes they can be decreased. But the idea is they don't go below 50,000. Now, I told you before that spontaneous bleeding such as petechiae, purpura, they're all commonly seen when the platelet count is less than 50,000. So less than 50,000 happens only with acute leukemia. It doesn't happen with chronic leukemia. So if it is less than 50,000, it is acute leukemia. So that will lead to the patient having petechiae, purpura, and all that stuff. All right, so we'll just talk about how to approach the questions when the question is given, whether it's AML, ALL, CML, and CLL. So one important thing is you have to know the age of presentation. So that is ALL, which is acute lymphoblastic leukemia, occurs in age group of less than 15, whereas AML happens in an age group about 20 to 50, and then CML happens at an age group of 25 to 50, whereas CLL happens greater than 50. So if you know these age groups, 70% of your answer is finished. ALL less than 15, AML 20 to 50, CML 25 to 50, CLL greater than 50. So there is some concentration here in the middle, that is AML and CML, they can happen in a similar age group. So ALL, you don't have anything, it's less than 15, it's usually ALL. Greater than 50, it's usually CLL, even though CLL question is rarely asked in the exam. So you're stuck within only these three, which is ALL, AML, and CML. If you see a guy who is less than 15, then it is ALL. But if you have an adult, young adult, or a middle-aged person, that can be AML or CML. That is where the confusion comes, whether it's AML or whether it's CML. So out of this, by the end of this video, you will be able to tell if it is AML or if it is ALL or if it is CML or if it is CLL. Now, don't quote me on this because 99% it is true that this will be asked, but all these things, remember, they can happen at any age. There is no specific age, but it is more common that they happen in this way. So in an exam, if a psycho guy sets a paper and he wantedly wants to misguide you, then just don't come after me for this video. Just excuse me for a while. But anyway, the idea here is please learn the age first. ALL happens less than 15, AML happens 20 to 50, CML happens 25 to 50, and CLL happens more than 50. So now, one more important thing are the buzzwords. So there are some words which tell you what diagnosis it is. For example, in ALL, you have testicular involvement and CNS. So ALL, testicular involvement and CNS. I like to remember it as testis is called as ball. So balls, right? So that is the layman term for testis. They call it balls. So all ball, right? So they are ball also has ALL in it, right? So all and ball is testis. So testis and CNS are seen with ALL. Whereas in CML, the word that you see is massive splenomegaly. So you see massive splenomegaly because splenomegaly can also happen with the AML and all that stuff. But when you see massive splenomegaly, they'll give you things like dragging sensation in the abdomen. They can give you coastal margin, all these things. So all these things refer to massive splenomegaly, and this is seen with CML. So classically, very classically in CML, if they ask you the question, they'll tell you something about massive splenomegaly. Whereas in ALL, they tell you about, maybe they'll tell you about testicular involvement and CNS involvement, meningeal involvement, all that stuff. Okay, but AML, usually they don't give you any buzzword. CLL also, they may give you lymphadenopathy, but that is very common with all those things. So based on this, we'll try to come to a diagnosis, we'll try to come to a conclusion of what happens here. So now, the flowchart that you need to know for answering this question is, firstly, confirm if it is leukemia, right? So don't answer RBC disorders or hemostasis disorders as leukemia. So first confirm if it is leukemia. So that is in the question, look for TLC. TLC is total leukocyte count, which is usually greater than 50,000 in leukemias. So if it is greater than 50,000, think about leukemia, or if they don't give you the TLC, based on the symptoms, let's come to the diagnosis if it is leukemia or not. Then look at the age. So if it is leukemia and if you see a 5-year-old, your answer is ALL. If you see leukemia and if you see a person more than 60 years, your answer probably is CLL. But if you see leukemia and if you see adult or a middle-aged person that is 20 to 50 years old, your answer can be either AML or your answer can be CML. So based on this, till here only 99% of your question is done. You already know the answer, but you have to confirm your answer by few things. That is, you just confirm if you get acute leukemia, just confirm if bleeding things have been given. That is petechia, purpura, epistaxis, or any patient has bleeding gums, etc. You have to confirm by doing that. And if it is chronic leukemia, just confirm with the case of splenomegaly. If it is massive splenomegaly, it is probably CML. And then confirm the buzzword. For example, once again, massive splenomegaly is CML, whereas if they give you any testicular involvement or any meningeal involvement, any CNS involvement, that is all ALL. Right, so we'll start the questions. So now this is the same question which I kept earlier. So first confirm it is leukemia. So in the question it says 3-year-old child has been admitted with fever and petechial hemorrhages for 2 weeks. On examination, child is pale, no liver or spleen enlargement, cervical lymph nodes are enlarged, TLC is 50,000, peripheral smear shows blast cells. So TLC is 50,000. So with this I can confirm it is leukemia. And then the age is 3 years old. So leukemia in a 3-year-old, your answer is ALL because ALL is less than 15. And let's confirm if it is acute or not. So petechial hemorrhages, I told you that petechial bleeding disorders are only seen with acute. So it is confirmed that it is acute. And one more confirmation is here nicely given that peripheral smear shows blast cells. So where do you see blast cells? In acute leukemias, because acute leukemias are proliferation without maturation. Usually there is not a lot of maturation which happens. So you have a lot of blast cells which are there, the precursor cells, this big blast cells which leads to all the problems in the patient. So this answer is ALL. Leukemia in a small child is ALL. Next. So we'll talk about the next question now. That is, a 40-year-old was admitted with easy fatigability. So what is easy fatigability? Anemia, anorexia, weakness, weight loss, night sweats, and dragging sensation in the abdomen due to splenomegaly. His total WBC count was 250,000. So we know that 250,000 is leukemia. So this person has leukemia. Now the patient is 40-year-old. So leukemia in a middle-aged person. It can be AML or it can be CML. So what do you think this is? Is it AML? Are we seeing any bleeding disorders? I told you that to confirm if it is acute or chronic. Are we seeing any bleeding disorders here? Anorexia, weakness, weight loss? No, we are not seeing anything. So it is probably chronic. So let's confirm this by seeing a dragging sensation in the abdomen. So what does dragging sensation mean? That the patient has so much splenomegaly that it's actually causing pain for the patient and dragging sensation in the patient. So this answer is chronic. So the answer is CML. So when you see this massive splenomegaly, such as they have given here, they have only told splenomegaly, but they're giving dragging sensation. So that means it is massive splenomegaly and the patient is 40-year-old and it is leukemia. So leukemia in a 40-year-old can be AML or CML, but because there are no bleeding disorders, we have ruled out acute, but there is dragging sensation in the abdomen. So we have ruled in CML, which is chronic myelogenous leukemia. So the answer to this question is CML. Moving on to the next question. Once again, a 32-year-old man. Now, in this question, we know that the TLC is 230,000. So 230,000 is leukemia, is a 32-year-old man. So it can be, once again, it can be AML or it can be CML. So we'll see whether there are any bleeding disorders. With history of weakness and dragging sensation on left side of the abdomen. On examination, his liver is enlarged to 3 centimeters below the costal margin and the spleen is enlarged. So there is nothing about bleeding disorders. So this is not acute. So it is probably chronic. So how do we know it is chronic? There is 3 centimeter below the costal margin. So they're telling you that the spleen is enlarged. So there is massive splenomegaly. So you have a 32-year-old with leukemia with massive splenomegaly. Your answer is CML, which is chronic myelogenous leukemia. So moving on to the next question. You have a 25-year-old female presented with fatigue, pallor, purpuric rash, intermittent respiratory infections, cervical lymphadenopathy and splenomegaly for a duration of 2 months. Laboratory investigation showed hemoglobin, which is 7. TLC is 50,000, platelet count 45,000, bone marrow revealed myeloblasts with numerous OR rods. So based on this question, so you have a 25-year-old female and the TLC is 50,000, so it is leukemia. So leukemia confirmed, number 1. Number 2, based on the age, it can be either AML, it can be either CML. So AML or CML is our answer. But in the question itself, they have nicely given that myeloblasts are there with numerous OR rods. Okay, so OR rods are more common with M3 type of AML, but the answer is AML, which is acute myeloid leukemia. So we know the answer, which is AML. Now confirm whether it is acute or chronic. So firstly, to confirm this, if it is acute or chronic, can you see this purpuric rash? So where do you see purpuric rash? When the RBC, when the platelet count is less than 50,000. So when you have severe thrombocytopenia, so it is a case of severe thrombocytopenias, and severe thrombocytopenias are seen with acute but not chronic. So even though splenomegaly is given in this case, we know that the answer is not chronic leukemia. It is rather acute leukemia, or which is AML, based on the findings that we have. So this answer is AML. So moving on to the next question, once again, the patient, they have given the TLC as 2,50,000 and the platelet count is usually, the platelet count is normal. Normally the platelet count is 1.5 to 4 lakhs. Anyway, so now the patient is 35-year-old. So 35-year-old leukemia, it can be AML or CML. But in AML, I told you there is a lot of bleeding disorders and the platelet would be much lesser. It will be less than 50. But here it is normal platelet count. So the answer is not acute, but rather the answer is chronic. So the answer is probably CML. And we can confirm this once again when they say the spleen is 15 centimeters enlarged below the costal margin. So when they give something like this, it means that there is massive splenomegaly. So leukemia, 35-year-old. So it can be AML or CML. Now there are no bleeding disorders and the platelet count is normal. So it is probably chronic leukemia, and based on this thing, based on the chronic, based on the splenomegaly, the massive splenomegaly, we call it CML. So the answer for this question is also CML. Moving on to the next question. So you have a male child, 8 years, presented with fever, fatigue, generalized lymphadenopathy, bone pain, petechial hemorrhages over the skin, pallor, enlarged testis, and features of meningism. So they haven't given us any TLC, but based on the symptoms, the patient has anemia, the patient has fever, the patient also has petechial hemorrhages. So all the RBC is involved, WBC involved, and platelets are also involved. So based on this, we can call it leukemia. And based on this, leukemia is less than 10 years. I mean, he's 8 years old, so less than 15. So your answer is ALL. To confirm this ALL, let's confirm it is acute or chronic. So the patient has petechial hemorrhages. So hemorrhages, petechial hemorrhages, spontaneous bleeding is seen in only patients with acute leukemia rather than chronic. So your answer is acute leukemia. It is ALL. And to confirm this, once again, we have enlarged testis. So I told you about the buzzwords, and in the buzzwords, I told you that ALL will always usually have testicular involvement or meningism, which is CNS involvement. So you have testis involvement, you have CNS involvement. So the answer is, without a doubt, the answer is ALL, which is acute lymphoblastic leukemia. So now once again, a 35-year-old, easy fatigability, anorexia, weakness, this, that. So the WBC count is 2 lakhs. So our leukemia is confirmed in this patient, and the patient is 35 years old. So 35 years old, once again, can mean two things. That is, it can be AML, it can be CML. So let's see if it is acute or chronic. If it is acute, you will see any bleeding disorder. I'm not seeing any bleeding disorders here. So it must be chronic. And to confirm this, we see massive splenomegaly. In the word itself, they have given massive splenomegaly. So our answer to this question is CML. Moving on, once again, a 4-year-old. So the last line they have given, the leukocyte and differential counts are abnormal. So they're telling it is leukemia. So number 1, we have got the diagnosis that this is leukemia. Leukemia in a 4-year-old, what is the probable diagnosis? It is probably ALL. To confirm this, whether it's acute or chronic, let's look at this epistaxis. So epistaxis, bleeding gums. So they have given that the platelets are very much decreased. So the platelets are less than 50,000 based on the epistaxis and bleeding gum findings. So this is acute leukemia. And for us to confirm it is ALL, we have seen CNS manifestations from meningeal involvement. So CNS is also involved. So our buzzword for ALL is also existing here. So it is an acute leukemia and it is ALL, which is acute lymphoblastic leukemia. So next, once again, a 35-year-old. So the total count is 1 lakh. So 1 lakh total count. Now, very importantly, it can be two things. In 35-year-old, it is leukemia. In 35-year-old, it can be AML or CML. So let's see if it is acute or chronic. So the patient has symptoms such as high fever, fatigue, pallor, skin petechiae, and swollen gums. So skin petechiae is there, swollen gums is there. That is, the patient has very less platelets, less than 50,000. So less than 50,000 you see with acute leukemia, not with chronic leukemia. So the answer here will become AML, not CML, but rather AML. Because this, if this was CML, you would have seen splenomegaly, you would have not seen anything to do with petechiae or not. But since you are seeing petechiae and swollen gums, your answer will become AML, which is acute myeloblastic leukemia. So moving on to the next question, a 2-year-old. So once again, the TLC is 1,50,000. So total count was 1,50,000. So in a 2-year-old, when you have higher count, the answer is ALL. Okay, so let's confirm this once again. First, let's confirm it is acute. The patient has fatigue, fever, epistaxis, and bleeding. So once epistaxis and bleeding gums are there, your answer is definitely acute, because that means that the platelet count is very less than 50,000, severe thrombocytopenia. So this answer is ALL. And to confirm this, have they given anything else? They have not given. They have not given about meningeal involvement or this, but just based on these things, I can definitely tell that it is ALL. So see the count, see the age. So here also they have given hepatosplenomegaly, but that doesn't mean that this is CML. So because all the other things, they don't match, but you have epistaxis and bleeding as well. So this is definitely acute leukemia, and based on the age, it is acute lymphoblastic leukemia. So next question, we'll once again see a 36-year-old female comes with swollen gums. So that is, swollen gums means you have platelets are less. So fatigue means the patient has less RBC, anemia, weight loss. She gives the history of repeated upper respiratory tract infections. That is, the patient doesn't have the ability to fight against infections properly. On examination, pallor, fever, and hepatosplenomegaly are present. So in this patient, they have not given you TLC, but based on the symptoms, you have RBC symptoms, you have WBC symptoms, and you have platelet symptoms. We are talking it as leukemia. So leukemia in a 36-year-old. So leukemia in a 36-year-old can be AML or CML. As we talked about earlier, it can be either acute myeloblastic leukemia or chronic myelogenous leukemia. So AML or CML. So let's confirm if it is acute or chronic. If it is acute, you will see some bleeding disorders, whereas in chronic you won't see bleeding disorders. So here we are seeing there are swollen gums. The swollen gums involves that maybe the patient has bleeding gums, because of that they are swollen. And also, very importantly, there is something called as repeated upper respiratory tract infections. So the patient, even though the total leukocyte count is high, the patient is unable to fight infections. And why is the patient unable to fight infections here? Is that because the answer here is AML, acute myeloblastic leukemia, wherein the myeloblasts are not becoming mature neutrophils. So the patient is unable to fight. So based on all these things, my answer is AML. Even though hepatosplenomegaly is given, that doesn't mean it is CML. I told you massive splenomegaly should be there for CML, and the bleeding disorder should not be there for CML. So based on all these things, the answer here is acute myeloblastic leukemia. And moving on to the next question. So here they have given you that a 30-year-old male patient have come with the moderate anemia, easy fatigability, weakness, weight loss, drying sensation in the abdomen. So based on this drying sensation alone, your answer should be CML. So 30-year-old leukemia in a 30-year-old is probably AML or CML, but based on this drying sensation, your answer is CML. And to make our things even easier, they have given you that the chromosomal analysis revealed the presence of Philadelphia chromosome. So you know Philadelphia chromosome is 922 translocation. So based on this, your answer is CML. So that ends my questions about AML, ALL, and CML. As you saw, there was no CLL question. It is usually rare that they ask you about CLL. They'll usually give you a case of where the patient is like greater than 60 years of age, and they can ask you that the patient has generalized lymphadenopathy, and they'll ask you what is the diagnosis. That will be CLL, but usually not asked. So focus on these three things, whether it's AML, ALL, or CML. So see, confirm if it is leukemia, confirm the age group, then see if it is acute or chronic. If it is acute, you will see bleeding disorders and you'll see recurrent infections, whereas in chronic you don't see both of these things. And lastly, you see the buzzword. For ALL, the buzzwords are testis or CNS involvement, whereas in CML the buzzwords are massive splenomegaly. So ALL, testis, and CNS, whereas in CML it is massive splenomegaly. So that will end my discussion about these things, leukemias. So if you are just studying, just see this and just go back to your textbooks to continue the discussion of leukemias. So I'll end my this thing here. So all the best for your exams, and yeah, see you somewhere later.